Sitting there and I'm pulling on the hose, right? And all of a sudden, like, I felt this giant pop in my head. Like, it was like, boom, something happened. And instantaneously, I had the worst headache I've ever experienced. It was absolutely debilitating. Like, it freaking knocked me on the ground, and I thought I was dying right then and there. So I was like, what the? And so I'm just like, nope, I'm good, because, I mean, you're a probie, you're on probation, you're like, nope, I'm good. I'm just like, I was dizzy, lightheaded, I didn't know what was going on, right? So I go home, right? They just kind of let me, because it was the very end of the day. I go home, and I'm just like, this headache just stayed the entire time. I was just like, before I went to bed, you know what I did though? I was just like, hey, told my wife, I'm like, so if anything happens tonight, I need you to tell the ambulance that I had the worst headache I've ever had. And this is what happened. Because I was just like, I don't know if I'm legitimately popping a vessel, if I popped a vessel and I'm bleeding out of my head, because like it was like migraine style, like 10 times worse than a migraine. Like I was nauseated. It was horrific, right? So it lasted almost.
Like, cool.
She probably slept.
Did you fill out your life insurance
Life
policy?
insurance done.
She slept good that night, I bet.
Right? But it was exactly that, because I knew if it was legit, if it was something legit, I knew if the medic unit had that information, that they would know exactly what the description was, like what I was describing, right? And so that would put them into the, oh yeah, this guy's probably a goner kind of thing, right? But it quickly gets them.
Good organ donor, though.
Yeah, good, yeah. Well, I don't know, way too much caffeine. And so it's just that kind of presentation. And so it went on for a week or so, and any type of exertion, it would increase again, and my headache would hurt again. I ended up making it on the line. I didn't tell my captain about it, and then the training captain came out and told him about it, and then he was pissed because I didn't tell him about it. He's like, hey, you could like die on a scene. I'm just like, sorry, I'm on probation, sorry. And so, worst headache ever is one of the big red flags.
Does it go away after like?
Yeah, just crazy. Just like I went in, had CTs done, and all kinds of stuff. And the doctor had no reason for what had happened. But it was like an explosion happened when it was like
really hot.
Yeah, we were way overheated.
No, the area.
Oh no. All right. So these are some of your signs of stroke, right? Piece of cake. All those. Yeah? Okay. Let's look over here. Let's start over here. Oh, what kind of patient can present with a coma?
Overdose. Diabetic.
Come on, fire them out there. Let's go. Diabetic. Okay, so we got diabetic and trauma.
Overdose.
That's it.
Do you say
I said
overdose?
Overdose.
Come on.
Inline.
Stroke.
Sepsis.
Autoerotic asphyxiation.
Okay, thank you.
It's not wrong.
No. Okay.
What did them all throw out?
Incontinence. Who can present with incontinence? Everybody, right? Anybody and everybody. Anybody with any sort of altered LOC, or anybody with inability to control their bowels or incontinability.
Whoa.
All right, dizziness. Who presents with dizziness?
Somebody pulling those.
Hypertensive.
So you notice how this thing's highlighted in red? So anytime somebody is dizzy, you have to rule out stroke, okay? Because a stroke can present with simple dizziness, and that will be your only presentation until you dive deeper into your physical exam. It is a common practice for paramedics to have dizziness and automatically chalk it up to what? Vertigo, right? Drives me absolutely bonkers. They don't do any sort of neuro exam, they don't do any of that stuff, okay? And so, what do they commonly miss? They miss the stroke. They miss the stroke alert. They're like, oh yeah, patient, funny. They can't even move the right foot the right direction, right? Like things aren't functioning. It's very small little portions of stuff that they're, or maybe they have a little bit of numbness on their face or something like that. So just common presentation, dizziness, you have to rule out stroke until proven otherwise, all right? Gait disturbance or uncoordinated fine motor movements. The gait, right? The captain trying to walk down this thing, kept running in, kept leaning to one side. Then you got all your paralysis. It could be any direction, left, right, front to back. Vision changes, vision disturbances. What happens if somebody has a headache and blurred vision. What do you think?
Stroke.
No,
Pulling too much out.
it's a migraine. It's a migraine, right? Right, Noah?
Yeah. My
No,
mom gets them all the time.
no. It's a stroke until you prove otherwise, and then you can go with the migraine, right? So what do we always start with? Worst case scenario, right? So it's a nice try. I kind of set you up a little
Your
bit.
head's falling off. Oh wait. No.
All right, so yes, so you're gonna get a lot, once again, with your vision changes, your headache stuff, you're gonna get people that immediately jump to the easy stuff, the migraine, stuff like that, right?
What are those
But-
3 words? Paris.
Paresthesia.
Paresthesia.
Paresthesia, hemiplegia, and, oh, there's both, it's paresis and plegia. What's the difference?
I don't know, that's why I asked.
Difficult versus complete paralysis, like so weakness versus full paralysis.
And that's hemi one side or the other.
Mm-hmm. And para?
Both sides?
I had a different question.
Oh,
I had a question that was not answering your question.
questions.
Someone had
So
it.
you're just like randomly going rogue right now?
Yes.
Okay, so we'll finish this really quick. All right, so what is para?
All sides have.
Okay, what?
Primary, P-A-R-A,
P-A-R-A.
along with
Huh?
I'm glad I asked. 'cause
Hemi, what is hemi?
Half.
Half, right? So this is where you can either be paralysis here, but most of the time it's paralysis here, right? Para, what's a paraplegic? All, right? Everything, right?
I
So
thought that was a
yeah,
quadriplegic.
quadriplegic.
Just feet, just arms.
right? So you have your para, your hemi, and your quad, right? So that's your full all-inclusive. So you can have paralysis any hemisphere of your body, left, right, up, down, and it's a presentation of a potential stroke.
So what's paresthesis?
Both
Numbness.
sides.
Okay,
Numbness and tingling on both sides? Is that what we?
Hemi, I would
All right.
say, is supposed to.
let's Google the exact terminology.
Says-
Oh, thank you,
Paresthesia is a
Janae.
tingling or prickling pins and needle sensation.
Para?
Usually temporarily, often occurs in arms, legs, and feet.
Okay.
Tingling.
So it's
Paresthesia, pins and
tingling.
needles.
Para. Hemi.
Hemiplegia.
Is that just
Are you looking that up right now? Difference between paralysis and plegia?
Well,
Don't be laughing back there, Lindsay.
hemiparesis
Yeah.
is muscle weakness or partial paralysis of one side.
Paresis and plegia is paralysis.
I noticed how you skipped over them.
See, you do this every time, man. Every time. I have a general idea of what they are,
And you're right
I have
on
no
this.
idea what those words are.
which is weird. I really expected more from you guys as a collective group. Janae, did you have something? Did you have some answers?
Paralysis.
What are you asking?
Oh, never mind. Too late. That's already got it.
Muscle weakness or partial paralysis on one side of the body.
Plegia is paralysis. Yeah, I knew that one.
Religious
Plegia is
paralysis.
paralysis.
And paresis is weakness.
Weakness.
And
then
hemi is one side of the
tingling.
body. And
And then
tingling.
Paresthesia.
paresthesia is tingling
Tingling,
or numbness.
numbness throughout,
Okay.
any extremity.
Cool.
Man.
That was rough.
Aphasia versus dysphagia.
I don't know.
You can speak versus difficulty speaking, right? So a common presentation, patient starts talking and it's making no sense.
But it makes sense in the brain.
Wait, maybe your patient had a stroke with
Maybe.
Raleigh.
Oh, maybe. No, this one was definitely making too much sense, right? So you're gonna get. So what they'll do is they'll probably go roughly 4 to 5 words of a sentence, and then what do?
They forget the word that they want.
No.
They can't find
No,
it.
they stop because the 4 or 5 words that they said are not the words that they were thinking. So then they get frustrated and they try to start over. And they try to come back with that again, and they continue to do that over and over. So the best thing to do, because people can still answer yes and no questions with that, is to ask them, it's like, hey, are you having a hard time coming up with the words? Like, is what you're thinking not what you're saying? right? And half the time you can just have them nod, yes or no, and then it's like, okay, cool. All right, we're getting somewhere with this, right? And so those are the types of questions that you're gonna add onto as you start to find these presentations out.
And sometimes
Okay,
they.
yes, Amanda, you had questions that were like 10 questions ago.
Yeah.
I quit.
Do you ever have a patient with
Get out.
with new onset myasthenia gravis that you could confuse
Let's
for
Google that.
stroke
Pretty-
syndrome?
Dustin, can somebody please look up what myasthenia
Pre-Google
gravis
that
is?
before he answered.
Patient with
I had a patient too that
MG
yeah.
the other day, and I had to look it up on my phone,
Yeah.
so I could act like I knew how to sign up with it.
Yeah.
I
So,
remember
my,
they
it's,
drug.
it's a neurological disorder that
Oh, it's
causes
the thing that-
diffuse muscle weakness.
Yeah, and they
Yeah.
often
It's
slur
what's
their
the Holly-
speech or
it's the
have
Holly-
Yeah.
numbly or
Right?
That was
What?
Bell's palsy.
Do you have
Oh,
Bell's
no?
palsy?
Never mind.
Those both.
Myasthenia gravis is like,
Never mind.
I
I
don't
don't
know
know
anything.
anything. I don't know anything.
You gotta take that.
It's what?
it's global, it's not local, so it's just like complete body weakness.
So,
So state, so it'd be different.
so what is the question about this now?
I was wondering if there could be new onset of it that you could confuse for stroke symptoms.
Right,
That
so,
the patient wouldn't be aware that they even had. the
yeah, so
condition.
absolutely. So any sort of medical condition, new onset can present atypically or present like something else. But how do we treat?
We treat it as a stroke.
We
until-
treat it as a stroke and we let the dentist make the determination what based on his medical expertise, what's actually wrong, right? So they're probably gonna do a CT, they have more definitive
ways to-
testing ability than what we have, right? Like we're limited on some of the stuff that we can test on, and so then we just go with what we can do. It's like if somebody presents with weakness, like unilateral weakness, it's like we have to go with the stroke, unless they have some sort of underlying condition where they say, hey, this is normal for me. It's like, oh, okay, because you'll get these common presentations where you'll get called for a stroke and be like, oh yeah, hey, they got left arm like paralysis, right? And you're like, oh, hey, there's a stroke. And they're like, oh, no, you're at a rehab facility because they had a stroke and they have deficits already. So we're not gonna do a stroke alert on somebody that already had these presentations. Does
Which
that make
makes it
sense?
difficult.
So you always go with, hey, this is gonna be a stroke in this type of situation because I can't tell you one way or another.
So a further question,
Oh, yes.
you say that it's common for somebody who's just had a stroke to have another one,
TIA.
or a TIA.
Yes.
How do you know it's just not the previous TIA?
So
but a new
TIA,
one?
so a TIA will go completely away,
Okay,
right? So symptoms resolve completely.
okay,
Okay, so boom, somebody has left arm weakness, can't move their arm, right?
yeah,
And then you get there and like, oh, my bad, yeah, arm's working fine, I'm good, right? And then they're like, yeah, I'm like, is it totally normal? They're like, yeah, it's totally back to normal. It's like, oh, okay, cool. So that's not normal for it to go numb for starters, right? So then you go in, hey, we should probably take you and get you checked out, right? And then they'll probably be diagnosed with TIAs. And then, boom, it happens again at a different time, right? So now, okay, is that clot the same clot? Like, is it a bigger clot? Same type of thing, underlying condition of clots, like how it progresses. Like, they can get worse and worse and worse to the point where they have a major clot that occurs somewhere in the brain that affects everything. And doesn't move on. It's wedged in there and it's stuck, and it will not clear itself. Does that make sense?
yes.
Awesome, fine, man. Whew. Yes.
How do you, like, what's the best way to
What is
assess
this?
some,
I'm trying to figure out what this is.
what's the best way to assess someone with like previous deficits from, or for a stroke? Like, I don't know if this is from a year ago, or is this brand new? Or is this worse than it normally is, or I have no idea.
So the next question is whether or not they can talk or not talk.
They can't talk.
Cannot talk.
I know this is like,
Family
That's
members.
very hard.
Yeah.
That's gonna be very hard, because you're not gonna be able, so, history, of the event, so if somebody has left side deficits already, and you're there because they have increased weakness on the left side, it's like, okay, well, how is that different? Like, somebody has to call in order to give you that there's a difference, right? So you have to go with, like, how is it different, right? Like, is it just, like, normally they can grab things, but it's weak, and then today they can't even function without that arm. That's a significant change, right? And so it's not necessarily a stroke alert, because they already have those deficits, But it's something that you're gonna call the doc and be like, hey, so I don't know what you wanna do with this. We had deficits, they say it's a little bit worse. Kind of bounce it off the doctor and try and figure out kind of what they wanna do with it. Does that make sense? It's like a half-hearted.
Yeah, it makes sense.
Okay. All right, let's go ahead and take a quick break.
Before you